Hello, good morning, everyone. Welcome to day 3 of our webinar series, Talk With Me. So today we'll have Jane to share with us about fluency and voice. Good morning, Jane.
Good morning, everyone.
Yeah, so we'll look forward to Jane's presentation. For those who are joining us for the first time, do feel free to send in your questions in the chat box and Q&A. Yeah, for those who have joined us several times, you know what to do. So go ahead and enjoy the webinar, and we'll see you later.
Hello, everyone. My name is Jane, and I'm a speech language therapist at Summers Therapy Services. Welcome to part 2 of our foundational webinar series, Talk With Me. So for this webinar series, Talk With Me, we have broken it into 2 parts, and you're in part 2 right now. So each part consists of 4 different areas of speech therapy. So basically in July, we have launched the first part where we go through 4 different areas. And this time we have launched another 4 that covers another area of speech therapy. So altogether we have 8 different topics right now. And for those of you who have joined us previously, welcome back. Thank you so much for taking the time to join in our sharing. For those of you who have just joined us today, welcome. Thank you for joining us. And if you're interested in looking at the topics that we have covered previously, we'll be putting up a link to our YouTube channel that will lead you to the videos of our previous webinars. All right, so now you're in day 3 of part 2 of the foundational webinar series. All right, so today we'll be talking about fluency and voice. So this webinar is a little bit different in the sense that it will be broken up into 2 parts. And the first part will be talking about fluency, and the second part will be talking about voice. All right, so the first part I'll be talking about what is stuttering, what are the possible causes of stuttering, and how to treat stuttering. And the second part will be looking at what is voice, what are the possible causes of voice disorder, and how to manage voice difficulties. Okay, so if you have any questions throughout the webinar, please feel free to type in your question in the chat box or the Q&A box, and we'll be spending some time at the end to discuss as many questions as possible. Okay, so let's see, what is speech? So for those of you who have joined our previous webinar, you'll be familiar with this diagram, which shows the communication pyramid. So if you're looking at the pyramid, those at the bottom layer of the pyramid, those skills at the bottom layer of the pyramid have to come in before we build on the skills at the top. And at the very top, the icing on top, we see speech. Right? And we have talked about what is speech. So speech is the spoken medium of language, is the use of spoken words. So it's how we say sounds and words. And when we're looking at the how of how we say sounds and words, we look at 3 different aspects. We look at articulation, in simpler terms is your pronunciation. We look at fluency, and we look at voice. So for articulation, we have briefly covered it in webinar 4 of the first part of our webinar series. And we have briefly talked about the different muscles that are involved to produce different speech sounds. So if you're interested in looking at that, please refer back to webinar 4. All right. So today, our focus is on fluency and voice. So let's first look at fluency. So look at all these people. So you have all these famous actor, actresses, musicians. We have Mr. Bean right there. Yeah, anyone know them? So Samuel L. Jackson, Julia Roberts, right? And we also have Joe Biden. So what do all these people have in common? So if you don't know already, all these people have had stuttering before. And look at where they are now. So well-known musicians, actors, actresses, comedian, and even the leader, the president of the United States, right? And Joe Biden could not say it better, which is stuttering doesn't define or limit a person. That is so important for us to know that stuttering doesn't define or limit a person. And according to NIDCD, which is also known as the National Institute of Deafness and Other Communication Disorders, they mentioned that most children outgrow stuttering. In fact, approximately 75% of children recover from stuttering. And for those remaining 25% who continue to stutter, stuttering can persist as a lifelong communication disorder. That's why early intervention is so important when the child's brain, when there's still neural plasticity in the brain and we can mold it. That's when we need to have early intervention to treat the stuttering. And stuttering occurs most often in children between age 2 and 6 as they are developing their language skills. So around that age, many children pass through stages of speech disfluency as they learn how to talk. So even as adults, we are not 100% fluent all the time. So this might be more prominent in certain situations or settings. For example, if you're nervous on stage, if you're under pressure, if you're going to social events where you need to talk in groups, or even speaking in another language that's not your primary language. So in that sense, we might be a little bit disfluent. So there's different disruptors of fluency. And there are 3 key factors that may disrupt speech fluency. And this includes attention, language, and environmental factors. So children may be disfluent at any time, but are more likely to be disfluent when they are tired, when they're excited, or when they're upset, or when they're being rushed to speak. That's when they're not really self-monitoring and there's reduced concentrating on their speech production. And that's when they might be slightly more disfluent. Another factor is language. So children may be slightly more disfluent when they are asking questions or when someone asks them questions and they have to answer those questions. So, and also when they're using conjunctions. So research have shown that when children are using conjunctions like the word and or because to combine sentences, to make longer sentences, that's when they become less fluent. And there's also environmental factors. So, for example, when they are being interrupted in a conversation, when they feel like, oh, there's a competition in terms of me having to take a turn in the conversation, or when there's increased time pressure when they're communicating with adults or their peers. All right. So now that we have covered what are the factors that might cause disruption in speech fluency that might lead us to be less fluent, let's look at what is the exact definition of stuttering. So according to WHO, stuttering is the disorders in the rhythm of speech, in which the individual knows precisely what he wishes to say, but at the time is unable to say it because of an involuntary, repetitive prolongation or cessation of a sound. So, stuttering is a speech motor disorder, whereby a person might have difficulties stringing sounds into words to maintain clear flow of speech. So it affects the smoothness, the continuity of speech. It affects the rate of speech. It can look quite effortful, and there's reduced coordination and the ease of motor movements as they are speaking. So it's not to do with language disfluency, whereby the child has difficulty formulating language. So see the definition right there, they know precisely what they want to say. So they know what they want to say, but it's just having that difficulty to execute speech. So on the surface, for some kids with language disfluencies, it might seem like they have stuttering. So it's really important for us to assess and to tease out whether it's a language issue or a motor speech issue. And if it's a language issue, then your speech therapist will work on the language skills. But sometimes there can be, and there might be a combination of both as well. And that's when we really, really need to tease out and prioritize what therapy approach we should use and prioritize what is important to work on at the moment for the child's overall functioning. And stuttering is also not the physical difficulties to produce sound. So it's not the having physical deficits. So it's not like they're having muscle weakness like dysarthria that is causing them to have stuttering. So similar to language, there might be a combination for some kids. So we really need to tease out whether the child only have purely stuttering or stuttering and other areas of difficulties as well. Right. So if you have joined us from our webinar about speech, you would know this diagram, and this diagram is showing how speech is formed. So look at the boy right there. When he wants to say something, first he needs to put his thoughts into words. So he needs to retrieve the words, and he needs to figure out in which word should I take out from my mental dictionary, and in what order am I going to put it to string that sentence I want to say. And after that, we'll figure out what sounds and in what order to say each word. And then your brain will send signals to your muscles to figure out which muscles need to move and in what order to string those speech sounds together to make up the sentence. So for stuttering, the child has no issues putting thoughts into words. There's no language disfluency in the sense that they have the vocab to structure that sentence. There's no physical disability in terms of the muscles that are involved to produce speech. But research have shown that there is some sort of a weaker neural connection that make this rapid fire, ultra precise speech system work in people who stutter, leading to disjointed kind of speech we all know, which is known as stuttering. So it's that neural connection from having the words there and sending the signal to the muscles. So now that we know what is stuttering, let's look at more precisely at the characteristics of stuttering. So stuttering is characterized by repeated movements. So you might repeat sounds like sounds, repeating syllables, like if I want to say the word umbrella, I might say umbrella, repeating words. So I want to go home, or even phrases. So for example, I don't know what to say. It can also be characterized by prolongation of sounds, so you're stretching the sounds. So for example, like this, like mommy, let's go home. And there's also blocks, and blocks are interruption in speech. So for example, if I want to say mommy, let's go home, I might do mommy, let's go home, or mommy, let's go home. So those are the primary characteristics of stuttering. And these speech disruptions may also be accompanied by secondary behaviors, such as interjections. So some kids might put in interjections like, I don't know what to do. Some kids might present with symptoms like having facial and body tension when they're stuttering, and it looks really effortful. They might have an open mouth, I want to go. Or they might do some eye blinking when they're stuttering, some lip tremor, maybe. Or inspiratory airflow. So inspiratory airflow is like breathing in air like this. When so it's a secondary characteristic that you might see when a child stutter. And there's also, there might be also changes in pitch and volume as they speak. So these symptoms of stuttering can vary significantly throughout a person's day. So it can vary in the symptom itself, and it can vary also throughout the day. So we call that hours of fluency. So it can vary in time of the day. For example, at the start of the day when the oral motor system is still warming up, or a child might stutter more at the end of the day when they are more tired. It can vary in situations, for example, like speaking before a group or talking on the telephone. It can also vary in activities. So, for example, singing or reading or speaking in unison may temporarily reduce stuttering. So as you can see, there's different symptoms, different characteristics, and so two different child that has stuttering might present differently. So it's really important for your speech therapist to assess and figure out which therapy approach may be suitable for your child. All right. So now that we have gone through the definition of stuttering and what are the characteristics, the primary and secondary characteristics of stuttering, let's look at the causes of stuttering. So what are the possible causes of stuttering? First, let's look at the types of the causes of stuttering. So there's two different types of the possible causes. So there's the developmental stuttering or acquired stuttering. So stuttering is commonly grouped into these two types. So for acquired stuttering, which is also known as neurogenic stuttering, it's something to do with the brain. So some impact to the brain, such as stroke, head trauma, block of blood flow to the brain, or a tumor in the brain. So basically the brain has difficulty coordinating the different brain regions involved in speaking, resulting in problems in production of clear, fluent speech. And at one time, all stuttering was also believed to be psychogenic, so caused by emotional trauma. But today we know from research that psychogenic stuttering are pretty rare. Now let's look at developmental stuttering. What are the possible causes of developmental stuttering? So, the precise mechanism that cause stuttering are not understood, so it's still under research. But we know that there is a genetic link to stuttering. So we know that 2/3 of children who has stuttering has a family history of stuttering. So this is just correlation. It doesn't mean that if a parent stutter, then the child stutter, right? So there's a possibility that when we look at a child who has stuttering, normally we also ask whether the family has history of stuttering. So any family members have stuttering, because we know that there is a genetic link. And we also know from research, current research, that stuttering can also be a result in which a person have small differences in how his or her brain is organized for speech and language. So it's still under research right now. But we know this from the ELF study, so the Early Language in Victoria study. So it's the largest epidemiology study conducted by the Murdoch Children's Research Institute in Australia, where they found 4 different factors associated with the onset of stuttering. So they found out that twins, so if one twin stutter, the other twin is more likely to stutter, as we have talked about genetic link. And for males, so we know that boys are 2 to 3 times more likely to stutter than girls. And this is a very interesting finding from the research. They have compared children who stutter and children who does not stutter, and they found out that for those children who presented with stuttering disorder, they have higher maternal education level. So their mothers have a higher education level, and this is very interesting. And the theory behind is because the mom will have taught them lots of language, and they get a lot of language stimulation, and therefore they have greater vocabulary, greater language skills. So their language skills is expanding, but their motor speech have to catch up with that. So those are the 4 different factors that is associated with the onset of stuttering. So it does not cause stuttering, but is associated. So we talk about children may have bouts in their childhood whereby they have normal disfluencies. So the question is, should we see a speech therapist, or should we just wait out for disfluencies to disappear? Because we mentioned before, from 2 to 6 years old, when they are learning to talk, when they have that increased growth in their language, we might see some normal disfluencies. So do we treat or do we not treat? So the best answer to that is get it assessed. So if you're concerned, go to your nearest speech therapist, get it assessed, and your speech therapist will determine to treat or not to treat. So basically, in the initial assessment, your speech therapist will consider a variety of factors before deciding whether to treat stuttering or not. So we will look at your child's case history, such as when the stuttering first noticed and under what circumstances, and analysis of the stuttering behaviors. We mentioned that there's different characteristics, so we really need to know in detail what characteristics we can see, what symptoms do we see. And we will evaluate your child's speech and language abilities as well, and the impact of stuttering on his or her life. If it's impacting them a lot, yes, we want to treat that. And your speech therapist will also evaluate whether your child is likely to continue with his or her stuttering behavior or outgrow it. So if we see that, okay, tentatively, we think that they will outgrow it, then we will delay treatment, but still monitor the behaviors while delaying it. So to determine this difference, whether to treat or not to treat, we have to consider a couple of factors. So some of the factors include age of the stutter. So if your child has been stuttering more than 12 months, yes, we would most likely want to treat that, because research has shown that if the child has not, so if it's less than 12 months, there's still a possibility for natural recovery. But if it's more than 12 months, we would want to treat right away. Okay, so we also look at severity of stutter. So whether it's affecting your child's daily functioning and their how much their peers could understand them or you could understand them. So the severity of the stutter. We also look at the child's awareness of stuttering. Do they show any frustration? So we know that stuttering has psychological impact, and studies actually showed that stuttering, when we compare children who stutter versus children who does not have a stutter, children who stutter are more likely to have social anxiety. They are 4 times more likely to have generalized anxiety disorder, 6 times more likely to have panic disorder. They also showed that children who has a stutter may have lower self-esteem. They might avoid social interactions, social events. They might have difficulty creating friendships as well. So it's really important to look at those aspects as well. We also look at parental concern. So if you're really concerned about your child's speech, you're very concerned that they are stuttering, yes, we would consider that as well, whether to treat or not. We look at family history of stuttering. As we mentioned before, 2/3 of children who has stuttering has a family history of stuttering. So again, I would like to point out that this is a correlation. It doesn't mean that if a parent stutter, then the child will stutter. So we look at the age of the child as well. Are they going to school soon? Because we would really want to treat that part, treat the stuttering before school, because we know there's psychological aspects to it, right? So children might have reduced class participation. They might be more reluctant to get involved in terms of, especially those oral presentations in school. So we really want to look at those aspects. So we also look at level of cooperation and concentration. So we can figure out which treatment type suit them. Do they have enough like attention and concentration to do to go through those therapy approaches that we will recommend? And we also look at other areas of difficulty. So do they have any difficulties with their communication skills, their attention and listening skills, or their speech and language skills? So we really need to figure out and to prioritize on which is most important. Then we can target those areas that are most important to help them with their overall functioning. So now we have gone through the possible causes and some of the factors that we consider whether to treat or not to treat stuttering. Let's look at how is stuttering treated. So there are very, very many different therapy approaches. And the thing is, there is no cure for stuttering. So some parents might ask, can it be cured? No, there's no cure. But we know that with young children, so preschool age from 2 to 6 years old, very young children, we capitalize on their the greater neural plasticity they have. So imagine when you're younger, your brain is like a Play-Doh. So it's still developing and it can be molded. And there's potential to teach these children how to be fluent. And how do we do this? Is by changing the environment around the child. Right? How do we change the environment around the child? So there's different approaches that we can use. We can reduce demands from the environment. So although we don't often think about it, talking effortlessly in front of people can be very difficult. And that's why it can be so powerful for children who stutter if the demands placed around them, around speaking, are reduced way down. So a lighter speaking load leads to easier, more fluent speech. Say that again. A lighter speaking load leads to easier, more fluent speech. So some of the ways to reduce demand include things like having one-to-one time alone with your child, so one-to-one conversations, to follow their lead, so whatever topics they want to talk about. Another thing that's really important, to not finish their sentences for them or guess what they're trying to say. So even though we might think that we're trying to help them, it actually creates more pressure. So don't finish their sentences for them. Let them say it. And every time they say something, no matter how it comes out, make them feel like what they've said is the most meaningful and important thing in the entire world for you at the moment. So in that moment, right? So you can encourage them to practice on their speech. And another thing is to make more comments instead of asking questions, so they don't feel like they're in the hot seat. So for occasions when you do ask questions, ask them closed questions instead, which can be answered in a single word or a small fact, instead of open ones, which requires more complicated language. So for example, instead of asking things like, "Oh, what did you do in school today?" which can be pretty open-ended and complex to answer, you could ask things like, "Did you have music class in school today? Did you like it?" which require only a yes or no answer. Another approach is the verbal feedback approach, and it's based on the theory that we praise fluent or stutter-free speech to increase or reinforce that behavior. Another approach is slow down speech. So as the term says, slow down, you literally slow down your speech. And this helps with two things. First, it's a model for your child to know what a smoother, more fluent way of speaking sounds like. And secondly, it builds more time so they feel less rush when they're having a conversation and therefore be more fluent. And the last one is syllable time speech. So syllable time speech is a technique that capitalizes of the rhythm's ability to induce fluent speech. So we're not going into detail today about the different approaches, and this is not the only list. There's many other approaches that you can use. This is just giving you a foundational knowledge and overview of some of the approaches that we might use. Basically, the goals for, especially for the preschool age children, is to reduce or eliminate stuttering, to have natural sounding speech, and to alter their self-perception. So alter their self-perception as a stutterer to a fluent speaking person who at times stutter. Right? So that's the psychological aspect of it. So when you go into school age, when they grow older, above 6 years old, there's reduced neural plasticity in the brain. So in that sense, there's less opportunities for us to mold the brain, right? So when it comes to therapy, sometimes we might do direct therapy. and direct therapy meaning making direct changes to speech. And when it comes to direct therapy, there are two camps. One is the stuttering modification approach, which is also known as easy stuttering. And another one is fluency shaping, which is also known as speech restructuring or prolonged speech. So stuttering modification main goal is to stutter, but stutter quickly, easily, and more effortlessly. So the person stutter quickly and easily and then can move forward faster and continue their speech. For fluency shaping, the main goal is to eliminate stuttering. So a person sounds more fluent and their speech can move forward faster. And for young adults and teenagers, young adults and adolescents, we might use similar approaches as well. So we might use direct therapy, which is making direct changes to speech. So there's so many approaches. Which approach should we use? If you have any concerns, again, I would encourage you to find your nearest speech language therapist, and your speech therapist will match your child's profile to an intervention approach that best suits their needs, right? And a major point that I want to point out here about stuttering therapy is that many people have many different opinions about the best way to treat stuttering. And many of them are perfectly right. So in the end, different things work for different people. Some things might work for you, some things might not work for me. So, or also many things may work for the same person. So our job is to simply take what works for the child and then leave the rest, right? In order to do this, we really need to assess, figure out which one suits your child the best. So do talk and discuss with your speech therapist. Okay, so that's the end of the fluency portion of this webinar. We have talked about what is stuttering, the possible causes of stuttering, and the different therapy approaches for stuttering. So now we have a little bit more time. Let's look at another aspect of speech, which is voice. So we'll be covering what is voice, the possible causes of voice disorder, and how to manage voice difficulties. So let's look at how speech is formed first. So speaking is the most physically complex thing that humans do. So after receiving signals from our brain, more than 100 muscles move precisely in sync with each other over a very rapid rate. So the first part that has to move to form speech is our diaphragm. So our respiratory system, our diaphragm, the muscle that is lying underneath our lungs, that pulls downwards, and we breathe in and filling our lungs with air, and then the air will be pushed out and it passes through the larynx, which is also known as our voice box in our neck, where a number of tiny muscles vibrate to turn air into sound, which is known as our voice. So that's the phonation part. And then that sound is then funneled through our mouth and our nose, where our tongue, our lips, our teeth, our cheeks, and other articulators shape it into the recognizable speech sounds that we make when we talk, right? So that's the resonance and the articulation part. So when we talk about voice, we're looking at phonation, so the larynx part, right? So when we look at voice, we look at 4 different facets. We look at volume, so I can be very loud or I can be very soft. Really sorry about that. And we can look at pitch. So I can be very high pitch or very low pitch. We look at quality of voice, so whether the voice quality is harsh, whether a voice is breathy, whether it's squeaky. So there's different quality to voice. Is it clear? And we look at resonance as well. So for resonance, some kids might have hypernasal voice where it sounds very nasally, where the air goes in through the nose, or it can sound very hyponasal, so as if like you have a blocked nose. So if we look at the diagram on the right from top to bottom, we can see that our vocal folds are closed when we swallow. So we don't want food to go into, so after vocal folds, you have your trachea and then your lungs. We don't want food to go in there. So when we are swallowing food, our vocal folds are closed. And when we are talking, our vocal folds are vibrating. So the air from our lungs causes the vocal folds, the little muscles there, to vibrate between open and closed position when we talk. So that's why when you put your hand on your throat, you can feel a vibration there. That's when your little muscles, that vocal folds, are opening and closing. And when we are breathing, our vocal folds are entirely open. So normal voice production depends on 3 subsystems. So firstly, the power and airflow supplied by the respiratory system, so air from the lungs. Secondly, the laryngeal muscle, so the muscles in the voice box. We need to look at the strength of the muscles, the coordination, the stamina. We also look at supraglottic resonatory structures. So we look at the pharynx, the oral cavity, and the nasal cavity. So these are the 3 different subsystems that is required for normal voice production. So a disturbance to one of the 3 subsystems of voice production, or disturbance in the physiological balance among the 3 systems, may lead to a voice disturbance. So voice disruptions can be due to 3 different causes. There's organic causes, functional causes, and psychogenic causes. So organic causes include the following. So there's structural and neurologic causes. So structural causes might be having vocal fold abnormalities. So sometimes singers or teachers, when they're using their voice a lot, they might have vocal nodules on their vocal folds, and is causing the vocal folds to not close properly. So that might be a voice disruption there, and it might change the quality of your voice. So you might sound a little bit hoarse, or some people might have inflammation of the larynx, so the muscles in the voice box. So for example, like having laryngitis, and then you might lose your voice, or even reflux sometimes might cause that as well. We have trauma as well, so direct trauma to the larynx. So one of the example would be from having intubation. So now we have, I'm sorry to raise this up. We know that we don't want to talk about COVID right now, but that's the topic that we usually hear right now. So if you look at some patients with COVID and they go on ventilators and they need to be intubated, so that's direct trauma to their larynx. And some of them work with speech therapists when they start to recover to work on their voice. Other examples of trauma can also include like chemical exposure or external trauma. So some examples of neurologic causes include recurrent laryngeal nerve paralysis, adductor or abductor spasmodic dysphonia. So that's just your muscles that are involved in opening and closing that vocal fold. So we are not going to go through in detail of all these scientific terms. I'm just giving you an overview. So let's look at functional causes right now. So some of the examples of functional causes can be phonotrauma. So this can be caused by excessive yelling or excessive screaming, or if you keep clearing your throat, you're actually putting a lot of force in your vocal folds. Vocal fatigue. So it can be due to putting too much effort. So your vocal folds are smacking, or overuse of your voice that might cause vocal fatigue. Ventricular phonation might be one of the examples as well, or muscle tension dysphonia. Some of the psychogenic causes include chronic stress disorders, anxiety, depression, or conversion reaction. So this is just an overview, as I mentioned. If you would like to know more about the terms and you're interested in knowing more about in detail of some of the causes, please feel free to type it in the chat box or ask those questions in the Q&A box, and we'll get back to you on that. Right, so now that we have gone through the causes, let's look at management strategies. These are only simple strategies that we'll go through today. Right, so before actually implementing healthy vocal hygiene, we really need to get down to identifying the behaviors that are causing and contributing to the voice problems. So behaviors like shouting or talking loudly over noise. So things that we can do at home, we can reduce noise in the environment, or so, for example, like switching off the TV, reducing the volume, not talking loudly. We also can manage behaviors like coughing or excessive throat clearing. And hydration. Hydration is very important. So our vocal folds need to be hydrated. So we need to drink plenty of water. So apart from drinking plenty of water to keep it hydrated, we need to talk in a moderate volume. So one of the things we can do as adults, if you realize that your child is yelling a lot, one of the things you can do is to model to them to speak in a softer volume, so that they can follow your models. Or you can also provide vocal rest. So as I say, vocal rest is really resting, literally resting your voice. So not to talk, and lead them to something that are more activities that are more action based. So things like completing puzzles or building Legos. Those are the things that they don't really need to use their voice, and more activity based for them to rest their voice. Right? So those are just simple management strategies that you can do for the voice difficulties. So that's the end of our webinar. We have talked about the overview of fluency and voice. We look at the definition of stuttering and definition of voice. We look at the possible causes of stuttering and voice, and also the different approaches to treat or manage stuttering and voice difficulties. So that's the end of our webinar. Now we will be discussing some of the questions that you have sent in. And thank you for joining us. And if you have further questions, and if there's other questions that you think about after we stop this webinar, please feel free to contact us at the links provided below. Right? Okay.
Okay, everyone, thank you for your attention. And now we're going to go through some of the questions. There are quite a few of that. So we'll have Jane to answer the questions as well. Jane.
Thank you so much for sending in the questions. So let me answer And from this person, it says, can stuttering in autism child who can speak well be cured? So we have talked about just now in the webinar, there's no cure because we don't know the exact cause of stuttering, the exact mechanism that causes stuttering. So we cannot say we can cure it. But what we can do is, for example, I'm not sure how old is your child, but if it's for younger child, we talk about neuroplasticity. Just now we talked about how when you're younger, your brain is like a Play-Doh, we still can mold it. So for younger children, we actually teach them ways to be fluent and to be stutter-free. So for the younger child, we actually, for treatment-wise, we actually teach them using like natural speech and actually teaching them to, praising them for fluent speech, let's say, and to increase that behavior of being fluent and stutter-free. That's how we help them to be more fluent, but there's no cure, unfortunately. But we still can teach them to be stutter-free, right? Hope that answers your question. For the second question, if we find difficulty to find speech therapist or the speech therapist suggestion and treatment, how we should do our stuttering. So I'm thinking that you're asking about if you have no access to speech therapy, let's say, how can you, what strategies can you use at home? Please correct me if I'm wrong, right? I'm just trying to interpret the question. Yeah, so some of the strategies that you can use at home, we talk about how you can reduce demands. So for example, you might not ask so many questions. Rather than asking questions, open-ended questions, ask closed questions if you really want to ask questions. Make more comments so that you can model to them when you're making comments also, you're actually modeling to them how to slow down their speech rate. By slowing down, there's more time to process and send the signals to the muscle so that you can help them to be more fluent. They don't feel rushed to speak all the time. So you give them time to complete their sentences, not to complete the sentences for them, not to comment on the stuttering. So when you realize that, okay, maybe your child is stuttering and having a difficult time to say out whatever they want to say, not to comment on it, because it actually put the focus on the stuttering, and it's like a vicious cycle where they feel even more stressed to say it out, and then the stuttering will be even more. So it's a vicious cycle. So we don't want to put focus on the stuttering. Rather than putting focus on the stuttering, you actually praise them when they have fluent speech. When at times where they are fluent, great, praise them. You're like, whoa, that's really fluent. That's really smooth. You're doing smooth talking. Very good. I like how you're speaking smoothly, and your praise need to be specific to the smoothness and the fluent speech, rather than just good talking. What is good talking? So yeah, so when you're praising it, you're actually helping them to know, okay, we're actually working on reinforcement of that fluent speech itself. So once again, reduce demand, reduce questioning, comment more, and when you comment, slow down your speech and model to them how to pause also when you're speaking. Especially at the start of sentences, you can stretch out the word, then continue to speak. So you're speaking like this, and you model to them so that they can be more fluent.
Can I also add that I'm not sure whether the person who asked the question earlier is from Myanmar, because we actually do have quite a big group of participants from Myanmar. I know they don't have speech therapy services there, and I used to travel quite frequently, like every 2 to 3 months, to work with some of the families and the children. But now, because of the COVID and I'm not traveling, we do teletherapy. So those who are interested, we're quite a handful who are on with us now doing teletherapy. So those who are interested can just drop me an email, and then we will take over from there. Yeah. So hopefully at least there'll be some support for your child during this period of time.
Yes, yes. Feel free to contact us anytime. Yeah.
That's right.
Yeah, and also if you want resources online, like there's the Raising Children's Network that has really good resources as well. I might put the link on the chat box later for everyone. And yeah, and they have strategies at home that you can do as well. So practical strategies that you can do. I know with the whole COVID thing, like it's a bit tough also for us therapists to see children one-to-one, but in terms of teletherapy, since Hui Ting has mentioned about teletherapy, there's really good evidence as well for like programs like Lincoln program that research have shown that the effect of one like face-to-face intervention and telehealth is actually the same. So there's good research on that as well. So that's just fun fact. Yeah.
Yeah. So yes, teletherapy is effective.
It's effective as well. Yeah.
Right.
So another question that I can see, so I've seen a man who has congenital stuttering, but he is so smart at his career. Now he's nearly 30, and can this stuttering disturb his life in some way later? Thank you for your question. And thank you for sharing with us. That's really nice that he's doing well in his career. Well, it really depends. As I say, two different persons with stuttering can vary, like in terms of the severity, the symptoms, how it affects the person's life. But it does show that some people who have stuttering, like it might affect them in terms of occupation-wise, for example, like if you go for job interviews, or you speak on the phone, or let's say you have oral presentation for your job, let's say, that have those kind of factors that might cause a little bit more disfluency, and it might have social impact, like let's say if you go for social events, it's higher stress level, right? So there's higher probability of being more disfluent that way, and there's psychological impact for certain people as well. Let's say if they feel like the stuttering affects them a lot, then they might have psychological impact. So it might affect a person's life in that way, but also research has shown that if you have ongoing management strategies to manage the stuttering, because for adults, we know that there's less neuroplasticity, they actually have strategies to help the person to be more fluent. So for example, using, the Camper Down program, which is like stretching the sounds and slowing down your sounds, and or you use prolonged speech, let's say, those strategies actually help them to be more fluent. Do the person have that strategy to help them overcome stuttering in certain situations? Yeah, so it really depends on that person. Yeah, and actually also to share that I know that in Australia they have this Speak Easy association where people who stutters, like they will come together and kind of just chit chat and practice those strategies together. I thought that was really nice. Like I know that I'm not really sure whether we have it in Singapore, but it would be good to start one. I think. Yeah. So we know that we have Speak Easy Association in Australia that will teach those strategies. Yeah, maybe I'll send that link also to let you all see a little bit more how it works. for the adult population. Yeah.
That's right. I think at the start of the presentation, Jane has shared how many famous persons are very successful in life despite having a stuttering. Yeah. So while it does affect them in some way, but they do well in life. So let's stay positive and encourage them. Yeah, be patient with them. I mean, personally, I know of a speech therapist who has got a stutter. So she still does well as a speech therapist herself. So it's really encouraging to hear of all these successful stories. Yes. Oh, wow. Now it's 12 o'clock sharp. I think it's about time for us to end our discussion for today. Tomorrow, we are going to have the day 4 of our webinar series. We are going to have a chat about feeding. The presentation will be a little bit shorter, but because we want to open up a lot of time for discussion. So do join us tomorrow at 11 o'clock. And thank you everyone for your attention. And thank you, Jane, for the sharing.
Thank you. And I'll share the link in the chat box for everyone. Okay.
Yes, and we'll see you tomorrow. Take care.